Welcome, and in this presentation we're going to go over ethical decision making in EMS. On completion of this presentation, the EMT should understand that while some sources use the terms morals and ethics interchangeably, most EMS curriculums still differentiate between the two, and given the opportunity, the EMT should be able to explain this difference. On completion of this course, the EMT should be able to thoroughly describe the concept of teleology, doing the greatest good for the most number of people; deontology, consistently acting according to rules; intuitivism, acting according to what feels right; virtue theory, acting as a virtuous person would. On completion of this course, and given an ethical dilemma, the EMT should be able to use the impartiality test, the universalizability test, and finally the interpersonal justifiability test. And they should be able to use these concepts to bring about an acceptable resolution to the dilemma. I kind of made this slide tongue-in-cheek, but with someone standing up at a podium and telling a large group of people there is no paucity of ethical dilemmas in EMS. And morals? Well, many college classes don't seem to think that there is. The textbook Organizational Ethics, a Practical Approach by Johnson, tells us that scholars from a number of fields appear to use the term ethics and morals interchangeably. So teleology, to act in an order to produce the greatest happiness, the greatest good as a consequence of your actions. This says we will base our decisions on the course of action that will produce the best outcome for the most people. Now, I may be dating myself in a little bit, but I'm going to use a quote from Star Trek II, The Wrath of Khan. And this is Leonard Nimoy as the character of Spock right at the end. He's dying. He's sacrificing himself to save others. And Spock looks at his very close friend, Captain Kirk, and says, the needs of the many outweigh the needs of the few, or the one. So, again, he acted in an order to produce the greatest good from his actions. The next thing we want to talk about is intuitivism. Act according to your inner sense of what is right or wrong. This is arguably the easiest theory to use, right? It felt right or it felt wrong. But also possibly the one with the most pitfalls, because in intuitivism, personal morals have a chance of influencing an ethical decision. The virtue theory is a very interesting one. The virtue theory tells us that we will act as a person of good character and a set of good moral examples, has a good set of moral examples for others to follow. And kind of summed up in the Christian perspective, this is, what would Jesus do? If we want to take it to other perspectives, maybe what would Muhammad do, or what would Buddha do? Act as though you're trying to emulate the most virtuous person that you know. And some, if you want to take it out of the overtly religious realm, would say, maybe what would Gandhi do? What would Martin Luther King do if he were in this situation? How would this most virtuous person that I know act? So those are four theories that come to us from the greater scope of ethical decision making. Now, let's kind of focus in on EMS ethical decision making and talk about three more theories. The impartiality theory, the impartiality, using the golden rule. Do unto others as you would want done unto yourself. In this test, you ask yourself if you would allow what you want to do, what you're going to do to your patient, to be done to yourself. This really is just to take on the golden rule. Do unto others as you would want done unto yourself. But let's take it a step farther. Would you want what is done that you plan on doing to your patient to be done to the most precious person in your life? If that patient were your mother, your father, your grandmother, your grandfather, your brother, your sister, a child, a beloved grandchild, would you want what you plan on doing to your patient done to them? So the impartiality test. The next one we want to look at, it is the universalizability test, performing the same action in similar circumstances. So, would you do this for any other patient in a similar situation? Would you do the same actions on any patient? Are you letting any type of bias creep into your decision making? And obviously, we cannot be ethical if we allow bias to creep in. We need to teach all of our patients in a like manner. So the universalist ability. We go to the next one, and I have to kind of tell you scenarios. And in this section, we'll be given a specific scenario, and it's going to have an ethical dilemma in it. And you'll use a specific tool to help bring about an ethical resolution. So let's do a decision. So in this scenario, you're told to transport your patient to a local critical access hospital only 8 miles away, so you should be able to literally be back at the scene within like 20 minutes. Your patient has only minor injuries, and the small critical access hospital that's fairly close is totally capable of taking care of this patient. The medic in charge of transport also told you that you need to return quickly to the scene because we have 2 remaining patients, both of them children, both of them still entrapped in the car, but they hope to have them out before you get back. And you need to be transporting these patients to the pediatric hospital about a half hour away. So, access hospital. While you're en route to the hospital, you call in on the radio and give the hospital an inbound report on your patient, and that you have now only a 2-minute ETA. As soon as you're off the radio, your patient tells you in no uncertain terms, almost yelling at you, "No way are you taking me to that Band-Aid station." He demands that you take him to the level. So is there an ethical dilemma? Reality test. To explain how we would resolve this dilemma. What actions would you take? And remind you the impartiality test, doing the greatest good. So, what if, and think about it. What decision would you make, and would you be able to defend that decision? Was it for the greater good? Would the 2 children have a better outcome and have a better benefit while your patient had less of a risk? So I tell you, this is actually a true case, and we did transport the patient to the critical access hospital, and no, he did not sue us. As a matter of fact, he was released later that day. So, but again, it did give a moral dilemma. There was some language used in this that I absolutely refuse to use. I will not use the language that the EMT driver used in this case, but I'm sure you could probably think of what it was. So you're called to a local critical access hospital to transport a 58-year-old male patient to a tertiary hospital about an hour away to the cardiac unit. The patient is having a heart attack. He has an elevated troponin. He has EKG changes that indicate he's probably had a heart attack, and the critical access hospital is just not capable of taking care of that patient. He has medications hung to help with that possible heart attack. He has heparin and nitroglycerin drips hanging. So you're getting reports from the nurse, and you're introduced to the patient's male spouse. The gentleman, the husband of your patient, asked if it would be possible that he ride the ambulance with you, since you have he has no vehicle, and there's no other way for him to get to the hospital to be with his husband. So you pull your partner aside and tell him this. Say that's not a rule. And he tells you that rule was never intended for gay marriages, which he, mind you, is morally opposed to. He also advises you that those people aren't really married. Finally, he tells you that if you insist on the spouse, and believe me, he did not use the term spouse, riding along, you can find someone else to drive him, since he's not having the husband, and he didn't say husband, ride up in the front with him for an hour. Wow. Is there an ethical? Would we apply this evenly across the board for any couple, any married couple, anybody that has a spouse? We don't even really care if they're married, as long as they're a couple. Does it apply to same-sex marriages? Same-sex marriages are legal in Illinois. Yeah, I would say that it does. I would say that it applies, and absolutely the husband can ride with his loved one as he goes down to the hospital in a very, very trying time in their life. Now we have another issue, one more. You're dispatched to a residence for a male who is very ill. On arrival, you find this 74-year-old male patient. He has an extensive medical history. He has type 2 diabetes and congestive heart failure, COPD, and renal failure. And as soon as you walk into the house, he looks at you and says, "What the hell are you doing here?" Well, you introduce yourself and you explain that his wife was worried about him and called 911. You ask him if it's okay if you assess him. He tells you yes, but he immediately tells you, "I'm not going to the hospital, and there's nothing you can do." You know that your patient is almost certainly. Is there an ethical dilemma? First off, did you have an ethical responsibility to transport that patient, even though he was alert, conscious, and oriented times 4? Maybe you could say he was alert, conscious, and oriented times 4, but he did not hold decision-making capability. So we'll leave that discussion. But what about your partner's actions? Were your partner's actions ethical or unethical? That's really a tough one. Ability test. Could you use it? Do you believe your partner would be able to defend his actions the next day to all the rest of the crew, to your peers? Would he be able to look in the mirror the next day and defend his actions? Would he be able to go to that patient's family and defend his actions? Could he sit in the medical director's office and the next day defend the actions that he did at that house? I leave that for you to decide. So again, ethics, a very, very gray territory. So with that scenario, I do want to wrap up. There are plenty of ethical issues that arise in EMS. We do have tools to help us solve these issues. And by using those tools, we can more effectively bring ethical dilemmas to a reasonable resolution. So thank you very much. It was a short presentation. It did go a little bit deeper into ethics and gave us a couple scenarios to think about. If you have any questions about the scenarios, ask me, ask in class. If you want to know the resolution for the last scenario, I can tell you a little bit more about that story. That was actually based on a real life scenario. So again, thank you very much. And I'm going to flip the page to the references pages. I used AAOS and I used Brady's books and several that came from kind of the greater world, specifically Organizational Ethics, a Practical Approach. So again, thank you very, very much for your attendance, and I hope you got something a little bit out of the program.